Well, we're going to talk about getting your eyesight corrected today in a fashion that maybe you have considered, maybe you haven't. Maybe somebody's told you that LASIK eye surgery is something you are not a candidate for. Well, I want you to rethink everything you think you know about LASIK eye surgery right now. Dr. Motwani is here once again with one of his favorite patients, Melissa Kremer. And we're going to have a great discussion talking about your condition here, because we've never talked about this before, Doctor. I don't think this topic has ever come up.
No. And this is an interesting topic because a lot of people who have eyes that cross, or eyes, what's called strabismus or lazy eye, a lot of them don't know that one of the best ways to keep your eyes straight is to have your eyes fully corrected.
So that they can focus properly.
And the actual muscles then keep the eyes straight, and they actually prevent and help lazy eye. And
so Melissa, let's talk to us about what was going on. You had, as a child, you had this condition, and, and I mean, how hard was it to live with and deal with?
Well, you know, I remember looking at baby pictures, and my eyes were like this.
Oh.
And I had surgery when I was 5, and it was okay growing up as a teen, but I got in my 20s, and my eyes started crossing in, and it was so self-conscious. Speaking to people, being in sales and marketing and healthcare, I would look at somebody and they would turn around. You know, you looking at me?
Oh, no.
And I could be as close as you are to me, Mark.
Right.
So it was very self-conscious. And like everybody, I went to Costco to have my eyes checked. And they said, oh, they couldn't do anything about my lazy eye. But
well, not at Costco anyway.
No.
Yeah, okay.
Of course. So they looked at me and they said, well, you know, your vision's pretty good, but we can get you some reading glasses. And so I went to see Dr. Motwani and with a friend. And I remember him looking at me, kept looking at me. I'm like, oh, he's probably looking at my lazy eye. And he said, you know, do you wear glasses? And I say, yeah, I have reading glasses. And he goes, do you have them with you? Yeah. Can I see them? I'm like, why does he want to look at my reading glasses? I'm like, okay, sure, here you go. So he comes back and he says, now, what were these glasses for again? And I'm like, reading glasses? And he said, well, they're not reading glasses, they're for distance. So what you've really been doing with your reading glasses is using what you thought were reading glasses, we're straining your eyes even more so.
Oh my goodness.
So he said, do you mind if I look at your eyes? I go, sure, I'm used to that. So he looks at them and he tells me, well, yeah, you have strabismus. I'm like, strabis what? Because I was never, lazy eye was never told to me as being strabismus. And he says, you have astigmatism, which I've never been told.
And hyperopia.
And
So
the list goes on.
The good news just kept coming.
Yes. And so he says, you know, I could fix your eyes. And I took a deep breath. I'm like, well, what part of my eyes can you fix? And he said, you know, I can help you see better. You won't have to worry about wearing these glasses, and it'll probably correct your eyes. And now, being a single woman, it was very self-conscious. I go, well, maybe now I'll get some more dates. You know?
Aww.
Well, you know, looking at a man, and he's like, is she looking at me or is she checking out the other guy?
Aww.
So,
well, Doctor, I mean, this is one of those cases that we've never talked about anything like this.
Yeah.
But I've seen very few cases that are as emotionally connected to what you were able to do for them.
Yeah.
Sure, and one of the things I noticed right away in her case was when we put the glasses on, her eyes were straighter. And when you correct a significant, in this particular case, when you correct her hyperopia and her eyes are able to focus, they're not trying to compensate, they don't turn in as much. And that probably just correcting her vision and getting her LASIK done corrected probably about at least 50–60% of the strabismus. So her eyes were already straighter at that point, and she could see properly. And then I referred her over to a pediatric ophthalmologist that did a little muscle surgery and finished straightening the eye. And the nice thing is now, because her eyes are corrected, there isn't a force that's going to bring them back in again. So she should stay straight. In other words, the original muscles, the original muscle surgery was sort of was done. It was straight, but she lost the effect because there was this pressure to constantly come in because she kept having to focus.
Wow.
Once we correct her eyes, now she stays straight, and that's just, I think it should stay that way for her.
Folks, Dr. Motwani has a very special offer for the first 7 callers. 50% off of LASIK eye surgery. 50% off. And even if with 50% off, if it still is a struggle for you, they have all kinds of plans and so forth that can help you out with the financing. and take care of it for you. Cost should not be the thing that stops you from doing this, but it might be the thing that gets you into the office with the 50% off offer there for the first 7 callers.
And the nice thing is we were able to do some monovision, so she continues to read. She's done on the Allegretto, so it's been stable. It's been over a year now.
Yes.
And so a lot of this really should stay with her, and she's, hell, your eyes look great.
I have people today that go, can you look at me again? I'm just not used to you looking straight at me and, you know, waving to people. They kind of turn. I'm like, so I used to do this, bye. And I see so many people that don't know that their vision can be corrected. I was told the same thing, that you're stuck with it.
So get in and see Dr. Motwani.
Yes.
Dr. Motwani, again, making this great offer for the first 7 callers, 50% off. But even if you've been told your case is impossible, I urge you, go in and see Dr. Motwani. Melissa, doctor, thank you so much.
Thank
you.
you.